The Honourable Van Staden is the next speaker.
Thank you, Chairperson. Chairperson, every year we see and hear from this department the most beautiful plans around strategic plans and annual performance plans and annual targets, but the question never gets answered on how these targets will be reached. Never do we see any concrete plans from this department to eradicate the huge problems we are currently having in our public hospitals and clinics, like, for example, service delivery problems, halting of life-threatening operations, the shortage of doctors and nurses, the problems regarding the placement of payments of interns, the shortage of medicine and equipment, the shortage of water in hospitals, hospitals who's currently burning down, the shortage of hospitals and clinics, the massive litigations against this department that is a staggering 111 billion rand, 14 billion rand more than in 2018-19. Infrastructure problems at hospitals and clinics, and the massive corruption cancer in this department. Due to all of these, patients are dying in our hospitals, and it is all over the news in the last few weeks. The cherry on top was when the auditor-general came and told the committee last week that there was massive corruption with PPEs, and we all know that. But what we did not know was, while there was a huge shortages of PPEs in the middle of a pandemic last year, hospitals in 8 of the 9 provinces had just thrown their PPE stock outside under a sail in the rain due to a lack of storage facilities. They even have showed us pictures of that situation. The FF Plus said that the portfolio committee must intervene in these matters, and that it is totally unacceptable that PPEs that was not handled with any care at all, and that the FF Plus demands that the head should roll in this ministry and in this department on this matter. Therefore, the minister must, and together with all the MECs of that 9 provinces, appear before the portfolio committee of health to come and explain to this unacceptable behavior and state of affairs. It is a shame that 600 healthcare workers had to die because of a shortage of PPEs, but meanwhile it is lying outside in the rain. The AG described it as an ineffective stock management processes, inadequate storage facilities, and poor storage practices. This government is a total failure. On the field hospitals, the AG said certain provinces that they had made plans to upgrade existing facilities from start did not follow competitive procurement processes. Contracts were not always concluded and approved as required. Minister McKeesie and Minister De Lille, you need to start explaining yourself. The quarantine facilities debacle also needs further explanation. This department is spending millions and billions of rands on an NHI system that will not be able to be launched unless all of these problems in our public hospitals is completely eradicated. We are looking at the NHI program at an amount of 121 billion rand, and the NHI indirect grant stands at 2.1 billion rand. Rather take this money that you are wasting now on an NHI system that we as taxpayers cannot afford, and use that money to buy more vaccines to try and stop this pandemic. Then the President and the Minister of Health can stop complaining about the so-called vaccine apartheid. Hou op om ander lande te beskuldig van 'n sogenaamde enstof apartheid. Julle het gesit en slaap verlede jaar in die onderhandelings en aankope vir enstowwe. Julle het 'n gemors gemaak met die hals oor kop aankoop van die AstraZeneca enstof nadat dit hier reeds 'n nuwe variant in die land uitgebreek het. Julle het 'n gemors gemaak van die sogenaamde uitrolprogram deur kort teikens se doelpale te verskuif en op die ou ende op 30 Maart weer 'n nuwe uitrolprogram aan te kondig. Julle weerhou die privaat sektor om self die aankope, berging en verspreiding van die enstowwe te behartig omrede julle van hierdie uitrolprogram 'n ingevulde wil maak. Nou vra julle waarom slegs 48,000 mense ouer as 60 jaar oud uit 'n groep van 5 miljoen mense geregistreer het vir fase 2 van julle sogenaamde enstofprogram. Want die regering word nie meer deur die burgery van hierdie land vertrou nie. Geagte meneer die president en meneer die minister, hou op om die vinger na ander lande te wys en begin self voor julle eie deur vee. Daar bestaan ook geen waarborg dat 40 miljoen mense teen die einde van die jaar ingeënt sal wees, of selfs vroeg in 2022 nie. Die adjunkt minister van Gesondheid sê gister aan gesondheidswerkers dat hulle inentings binne die volgende 2 weke afgehandel sal wees. Hoe kan u sulke uitlatings maak as u voor u siel weet dat dit nie gaan gebeur nie? 1.5 miljoen gesondheidswerkers is daar maar nou is 430 mense ingeënt. Hou op om beloftes en uitsprake te maak wat nie nagekom kan word nie. Hierdie regering is nie meer bevoeg om aan die bevolking van Suid-Afrika gesondheidsdienste kan lewer nie. Weg met die nasionale gesondheidsversekering, weg met die ANC. Voorsitter, Die tyd het aangebreek dat ons ophou om net te praat oor die probleme in ons openbare gesondheidsstelsel, maar dat daar 'n werkbare plan en oplossings op die tafel geplaas word om hierdie probleme op te los. Dit is duidelik dat die nasionale gesondheidsversekering nie daardie roete is of mag wees nie, en dit is duidelik dat die ANC nie daardie roete is of mag wees nie. Dit is duidelik dat medisyne, die burgery en privaat organisasies nou na vore moet tree om self daardie probleme op te los. En die VF+ is bereid om daarmee te help. Dankie, voorsitter.